Hi, this is Mary the Medicine Woman, and this video goes along with my blog post called The Remedy for Modern Healthcare, where I talk all about the fact that we're no longer in the drug distribution business as pharmacists, but more in the behavior modification business. So I would like to kind of expand on that by giving you an example in another industry that is related to ours that does a really good job if the rep is good with behavior modification. And that is our friends in the drug rep business. So a drug rep, we're all familiar with them, right? Their job is to represent their company and the medication that they sell. And also their job is to move product, right? They need to sell those drugs. So a good rep will link the drug, the medication that they're trying to move to a specific behavior that they want to see. Because the bottom line is it's all about behavior. If the prescribers don't write for the drug, it's not going to move. And the pharmacist also can have a role in making sure the drug is properly used, which is good for the patient, or suggesting the drug if that's appropriate too. So those would be the behaviors that they want to change. So I'm going to use an example, a drug that I made up, and it is called Exemplify. All good drugs should have an X or a Z in it now, apparently. So this is my drug that I made up, again, totally made up, fictitious. It's called Exemplify. And this is a medication that I made up specifically for people who have anxiety and depression because they are blocked creatives. So they're painters that can't seem to paint anymore, or they're writers that can't seem to write anymore. So they're blocked creatives. That is what my made up drug is for. So if I was a good rep for Exemplify, I would go into the doctor's office and not just tell the features and the benefits, how it works, what it does in the body, and who's it for, but I would link that to a specific behavior that I wanted the prescriber to do. So I would say, as a good rep, listen, this Exemplify works in the brain and it helps creatives unblock their potential. So if you see, doctor, that you have to add a third antidepressant or an anti-anxiety medication onto an antidepressant, could you simply ask your patient, hey, do you happen to be a creative person that is blocked in some way? And if the patient says yes, then instead of writing for that next antidepressant or anti-anxiety medication, could you please write for our new drug, our lovely drug that helps unblock creatives, Exemplify? And that's what they do. So they link the patient and the behavior that they want the prescriber to do. And they could also then, a really good rep will go to the pharmacy and say to the pharmacist, hey, I have this new medication. And when you see a doctor who's prescribed like the third antidepressant for your patient and you're just about to counsel that, maybe when you go to counsel that patient, ask them, hey, do you happen to be a creative person that is frustrated with your lack of creativity lately? Why don't you ask your doctor about Exemplify? So we're linking the medication, this new medication, to a behavior that you want the pharmacist to do, which is then to ask the patient, to ask the doctor, or even you could, as the drug rep, say, hey, listen, if you see that third antidepressant, call the doctor, ask them to ask their patient if they're a blocked creative and they'd like to try, instead of this third or fourth antidepressant, Exemplify. So, in summary, you have the medication, fake medication Exemplify. We have its features. Obviously, all medications have a feature, how they work, what it does, how it works, who's it for. And then in this case, it's for blocked creatives who are on other medications that aren't working. They're still blocked. And then what do I do? So that's the key. A good rep will tell the doctor, if you see this, then you do this. Same with the pharmacist. If you see this in your patient, please do this, which is call the doctor and suggest our new drug, Exemplify. So that is an example of how you link, and using another industry, how you link a product to a behavior that you want to change in the provider in this case. And then in the next video, I will tell you how this can apply to the pharmacist and how we can then use the same kind of system to change the behaviors in our patients. So that will be the next video. Thanks for watching this one. Peace.